Yes, and so thank you for that. This is a photo of me getting my vaccine yesterday. Yeah, Colleen, the director of public health, was the nurse who administered it to me. And I wanted to say out loud how grateful I am that this community allowed me vaccination, and that here we are at the beginning of our efforts, and to think that that Lake County was able to get vaccinations when only 600,000 Americans thus far have been vaccinated, and so we were very early on in the process. And that Colleen Nielsen worked so diligently to get healthcare workers vaccinations. I'm grateful, and certainly I feel very privileged to be part of the medical effort here. And that with your confidence in me, offering me a vaccination, please know how hard I will continue to work to take care of us. If you look at the Colorado data, we are on a downslide, thank goodness. The Thanksgiving surge is over, and we are seeing a decrease in overall infection rates throughout the state. The positivity rate is also declining. We had a peak after Thanksgiving, and then now the positivity rate is decreasing. So although we're continuing to be very robust in testing, we have a decrease in overall positive tests and all of the tests that are being administered. Colorado still has a very high rate of infection. So if you look at our cumulative incident rate, we're still in the dark brown color. And I don't see that this will change much over the next several weeks. We are anticipating a surge for Christmas as well, similarly to what we saw for Thanksgiving. So we'll see the numbers increase again. But at least for now, they're down. Hospitalization rates also have declined, giving the hospitals in Colorado a little breathing room. I'm sure everyone has seen, what's happening in California and in Texas, and they're just swamped. But we do have a little more breathing room here in Colorado as more patients are being discharged with COVID. Deaths, as you look here, highest that we've seen in Colorado since the beginning of the pandemic. And unfortunately, that does mirror what happens when we have more cases. And I expect that this trend, unfortunately, will be reproduced again with the Christmas surge. Our data looks pretty similar. We've had our cluster of cases here. We've had some days, unfortunately, with 12 or so positive cases in our county. There were times, as you remember earlier on, where we had 12 cases all month, and we got that, in a daily total. So things are not fantastic out in our neighborhood. Our positivity rate has decreased slightly from where it was before. So although we're still being very aggressive at testing, the number of people that are positive from those tests have decreased as well. Our curve does not appear flat at all. Hospitalizations, we're holding our own. We have had consistent COVID patients here in the hospital at St. Vincent's. They're doing all right. We're doing our best to help alleviate our neighbors, and so we are accepting transfers from other hospitals for patients who do not have, cardiopulmonary disease, who can tolerate the altitude. But we've had transfers as far away as Rifle to use our facility here. So we are continuing to work as a cohesive medical team throughout the mountainous region in Colorado. Our total total positive results, over 300. If you look at, again, what happens from the state level, that number is now approaching 400, knowing that there are people who go outside of Lake County to get their test. Our positivity rate has decreased some. We're pretty much the same as what the state is. So, again, good news. We are, proverbially holding our breath for what's going to happen over Christmas. And I can't say it enough that it's, still very important for us to remember, even with the vaccines rolling out, that you still need to be very careful about congregating in groups. And we know that that's where the problem is that people are having parties, people are having folks in enclosed spaces and not socially distancing, not keeping their mask on, and that's where people are getting infected. So there we are, better than it was last week. And, I told, Colleen a little bit yesterday that I felt like a Labrador retriever waiting for someone to throw the ball. And I must have called her, poor thing, 100 times yesterday. Are they here yet? Are they here yet? Did they come? And finally, we got a delivery about 11:30, 12 o'clock yesterday. So Rocky Mountain Family Practice has been vaccinated. St. Vincent's is being vaccinated as we speak. Hopefully we'll continue to get vaccine delivery every week or two. And our next phase, so we're 1A, 1B will be our next rollout, and that's our first responders, emergency folks, fire, police, sheriff, etc. Again, thank you, everyone. I again continue to be very grateful and feel very privileged to be able to work in this community and be part of this effort.
Thank you, Lisa.
You bet. Thank you, Dr. Lisa. We do have, if you are able to join us next week, one more in 2020.
I'll be there with bells on. I do want to be a source of factual information for our community as well. I think it's very important that people have a source of where to go to. I have done my vaccine presentation to multiple groups. I think my last one is to the Sheriff's Department on Monday. But it is published on the Lake County Public Health website. We did it during the town hall last week as well. So please, if you'd like a preview, you're welcome to look at that and learn about the vaccine. And of course, I am always available for anybody who has questions. Whatever I can do to encourage folks to become vaccinated certainly is of utmost importance.
Well, let's hope that the Christmas surge is less robust than the Thanksgiving surge.
Yeah, absolutely. And I'm happy to report that I did have an appropriate immune response to my vaccine yesterday. My shoulder's a little achy, which is great news. It means I'm still healthy enough to mount an immune response. And so life is good. And I did not turn into a frog.
Now, did you get the Pfizer or the Moderna?
Yeah, Moderna is what's available here in Lake County. We don't have the ultra cold storage facility to be able to accommodate the Pfizer vaccine. So all of us who will be vaccinated here locally will get the Moderna vaccine.
Oh, okay.
Is that a 1 dose or 2 dose?
It's a 2 dose.
That's a 2 dose.
Both the Pfizer and the Moderna vaccine are 2 doses. This particular one is 28 days apart.
Okay.
So when do they get to the plus 65? Greg and I are wondering.
Yeah. You're in phase 2, and we are very hopeful that we will have that well underway by March. It all depends on vaccine delivery, and so if we were able to get thousands of vaccines yesterday, then we would be there already. But it just depends on vaccine distribution, and what they're telling us is that we should be able to have that by spring.